Welcome back. Infertility affects about 1 in 6 adults worldwide, but many struggle in silence. We're sitting down with Dr. Bitner with True Women's Health to talk about this, the causes of infertility, and the options that are out there if you are trying to start a family. Of course, we know there could be a lot of barriers to beginning a family, but with infertility, how is it defined and how is it diagnosed?
Sure. So, 1 in 6 people deal with this worldwide.
It's a lot.
It's crazy, and it's no matter what country, socioeconomic, ethnic background, there can be issues. The definition of infertility is unprotected intercourse for a year with no pregnancy.
Okay.
And so some people do get impatient. Like my friend got pregnant first month, like I just want to get pregnant. And it can take time. I mean, depending on your age and all the things, like it can definitely just take time.
Yeah.
But if it's been a year, then there might be a factor at play.
Yeah, and important not to maybe blame yourself if you are running into these obstacles when it comes to having a baby.
Exactly. We like to talk about it's not someone's fault. There are factors, right? There are factors, male factors and female factors. And how we break it down is essentially in compartments.
Okay, let's talk about the female concerns here when it comes to fertility.
So female factors, we can think about, for example, the brain. Is the brain sending messages to the ovary to develop eggs? So are there thyroid issues? Are there metabolic issues like severe stress, calorie deprivation? The body's in survival mode. It's not going to be talking to the ovary. Does the ovary have enough eggs? Some women will have premature ovarian failure, as in they run out of eggs sooner. Are those eggs working well? Is the message being received? So if people have high insulin, high blood sugars, PCO, we've talked about that a lot, the ovary can't listen as well.
Yeah.
And then are the tubes open? Is the uterus healthy? Is the cervix open? So we go through it and just think about, in terms of that, so then we can diagnose and then hopefully resolve.
Yeah, and infertility is not just a woman problem, a female problem here. There's also some male concerns to look at as well.
Same thing. So again, we look at male factor. Most commonly, it's maybe that the sperm production isn't what it could be, maybe because there was an injury with a baseball in high school, right? Or maybe there's a heat issue. Some men have varicose veins that bring a lot of warmth to that area, and they're not able to make as many sperm. And it's a simple diagnosis and resolution. So again, a lot of people don't even want to go there because they're afraid they might find something. So often I'll ask people, what are you afraid of? Well, let's just get into the issue and figure it out, and we don't have to worry about it.
Yeah. Can we talk about Jane's story quickly?
So Jane came to the office and she had been given a fertility drug by her doctor. It was like, I want to know why I'm not getting pregnant, not just be given a drug. So we sorted things out, and turns out Jane had a ton of stress, and she also had metabolic issues that she went on metformin. She was able to lose some weight, get her blood sugars down, and she's pregnant.
That's great. So there's help out there, but you can't be scared to find out the answers to figure out what's going on.
Just face it, and it can be very straightforward.
Is that your takeaway tip for us?
That's my takeaway tip, is that if you're not achieving pregnancy like you want, figure out the why.
Yeah, reach out to your doctor first, and then maybe you'll progress on to the OBGYN, but there's so much help available.
So much help.
To start your family in different ways these days.
All right. Don't be discouraged.
Dr. Bitner, thanks so much. We'll be right back after this quick break.